I'm Timothy Justinger, and this is my presentation, Applications of Case 4 to ABC Healthcare. It's in MHA 616, Healthcare Management Information Systems at the University of Arizona Global Campus. My professor is Dr. Ashley Tennessee. This is on August 22nd, 2022. All right, let's get started. So, although recruitment of physicians is a problem for healthcare organizations, there are steps to leverage the staffing and structure the organization's environment to foster changes in ways that surpass telemedicine by utilizing digital health. The presentation will compare the Case 4 study of Grand Hospital with that of ABC Healthcare, of which is of many medical treatment facilities that align within the Department of Defense. The Department of Defense's medical authorizations has overlooked gaps. Its overarching strategy to fill these gaps focuses on the individual service elements and relies on university programs, scholarship programs, and other initiatives to attract and keep physicians. The strategy, however, does not include focused and coordinated efforts to alleviate critical physician shortages. Every component has scarcity in a few different specializations. Some are below 80% of allowed levels and are critically short wartime specialties. The ability of the services to provide medical treatment to service members during a conflict may be in jeopardy until they develop and implement these measures. All right, the needs of ABC Healthcare. So use the Pickett approach. Population and problem is the need for more physician coverage of specialties within the hospital without the means to hire more staff. The Executive Medical Committee of Grand Hospital focused on specializations in radiology, behavioral health, and intensive care. ABC Healthcare has similar issue in need to leverage existing medical staff with the increased patient care requirements. The intervention is the incorporation of electronic health technologies. Telemedicine was the means in Case 4 wished to fulfill by expanding healthcare requirements of the population. However, telemedicine is an excellent start to solve an issue. Electronic health technologies expand past just telemedicine to leverage the existing staff. Comparisons show different ways to conduct medical care using traditional patient care visits. ABC Healthcare does not have enough staff to handle the increased workload with telemedicine. There are more options to contact a patient provider. With the help of electronic health technology, there are many ways to reach providers. According to the National Library of Medicine, digital health encompasses telemedicine, mobile health, telehealth, and other health information technology that affect health. Outcomes will show that leveraging staff with electronic health technology will produce more available means of connecting patients to providers. The result will reduce patient queues and increase access to care percentages for the facility. Time for implementation is dependent on many factors. The project team, steering committee, and the organization's budget are variables that control the time needed. Specific time measurement is 1 fiscal year. ABC Healthcare loves using fiscal years in budgeting since they are the entity under the Department of Defense and the Defense Health Agency. All right, the risk analysis strategy. ABC Healthcare is a hospital that is part of the Defense Health Agency and is not limited to federal laws. A federal law that the Defense Health Agency follows is the DoD Directive 5124.02 that establishes policy under governing health information privacy and the breach of the privacy. My plan to build off the requirements is to have each user log in with a monitored account. Automated log off of the device is a simple, effective procedure to prevent a violation. Encryption safeguards the data, and decryption linked to each end user account decrypts the data for access purposes. Finally, audits conducted will be by the Information Systems Department will quality check the compliance of users and devices. Unlike integrity, these standards are tangible and available to monitor progression. Military healthcare must become competitive and develop and practice strategies and integrate and balance its goals, methods, and resources. If that doesn't work, the private sector will take over military medicine. Cloud misconfigurations are a severe data risk posed by human mistakes, hampering security compliance and thwarting digital transformation projects according to the technology and security decision makers. Healthcare decision making. Evaluating the planning and analysis is an important place to start identifying any problems or areas that need improvement. Simply a requirement for the implementation of something new and feasible. There are important areas to see feasibility as if the technology will work whether it will be in the financial budget, and whether it will be operable in the organization's environment. Evaluating the design is the process by the organization team or a third party in information technology. Vendors provide means or support to fix issues. Evaluating the implementation is the process that includes, but is not limited to, everything from assembling the workflow to knowing when to implement the new system and training the staff on using it. Evaluating the support and evaluation is the final step, but can lead right back to step one, since the step checks for the need for more staffing or glitches or any other kind of thing that could pop up. Organizations can match consumer needs with the help of experts who can evaluate and synthesize data to find answers in business challenges, thereby boosting sales and profitability. Technological impacts. Knowing the culture of medical staff and the patients using digital health to keep their appointments is essential before starting system deployment. Before investing, it is critical to understand the culture. The new system will succeed if physicians actively participate in its design and construction. The workforce will become invested in the project if the administrators support the project teams. Suppose you don't have enough staff devoted to the project or enough medical staff buy-in and support. In that case, you are under the danger of running into user resistance and system failure because of insufficient use. Roles and responsibilities. So Mr. Thomas Patrick Flanders is the Chief Information Officer and Program Executive Officer for the Defense Health Agency and is over ABC Healthcare. The CIO can delegate resources to teams. Project steering committees demonstrate leadership with oversight and help to align the project. Project steering committees work with the project teams to resolve complex issues and prevent surprises through analyzing solutions. The Defense Health Agency that manages the ABC Healthcare uses evidence-based practices in their processes. The Core Oversight Committee for the EVP Council was to include representatives from the clinical, business operations, information technology, public health, environmental industrial health, quality and safety education, and training fields. Enterprise-wide governance. Healthcare data governance ensures the data is secure, the data is reliable, and the data is available to those who should have access to it. Before implementing the system enterprise-wide piloting, it is in the section or unit is advised before most system users even begin using it. This test lets the implementation team assess the system's efficacy, solve problems and concerns, correct defects, and then apply the lessons learned to other organizational units. Vendors frequently provide guiding concepts and implementation techniques they discovered successful. Technology on governance. The role of standard developing organizations is to develop standards that align with the industry standards like medicine. Under United States legislation, SDOs need to have a way to balance interests in developing standards and not bias by ensuring the decisions are based purely on technological rationality. There are legal consequences for an SDO failing to disclose certain information and being encouraged to reveal intellectual property. SDOs play an important role in governance, as previously stated. The concept, procedures, and administrative frameworks that control IT resources are referred to as IT governance. Best practice. Technology necessitates new governance structures that bring together representatives from the cooperating organizations to address their inter-organizational IT problems, like the permitted use of shared data. Interoperability is the capacity of a system to use and exchange electronic health information with other systems without the need for additional effort. Agencies for Healthcare Research and Quality is to produce evidence to improve healthcare safety, access, and quality. Digital health can have a positive impact economically on ABC Healthcare. Implementing digital health can save money by treating patients with their need to travel to different facilities. Another way it can have a positive impact is getting more medical talent for specialties to be available in what would otherwise be difficult circumstances. Alaska is already a very remote geographic region of the world, and the military health system is even more so. As stated in the previous slide, the military health system requires mobility and operates with spokes all over the ports of Alaska and nearby islands. For the purpose of this presentation, a spoke is a remote location comprised of a few doctors, nurses, and highly trained combat medics that soon will be able to operate through digital health, it hopes. By virtual appointments, unfortunately, limitations exist on shared information outside the Department of Defense channels, but digital health is vital to the mission of Arctic domination. Navy operations use telemedicine as a multiplier for force for health at sea or extended deployments, and it improves medical outcomes across the battlefield. And telemedicine falls under digital health. All right, and then we have the board questions. What happens if the word should happen and data is breached? Well, a HIPAA breach notification rule also requires an organization to report a breach to all individuals affected within 60 days. Steps would then be taken to remediate the vulnerability and prevent future problems. What challenges do you foresee with the new implementation? Well, people may not want to change to include the staff and the patients. People may want the person-to-person visits. Any endeavor will likely be doomed by a resistive organization. Projects that are perceived as fraudulent by a significant number of employees in an organization rarely succeed. Another question, how many people will this affect? Well, ABC Healthcare currently services over 32,000 people to include not only service members but civilians as well. All right, in conclusion, although telemedicine was the approach of Brand Hospital, digital health will expand capabilities far beyond telemetry. Why take baby steps in the future when leaps are obtainable? And we have a reference slide right here. Hope that's correctly formatted, because getting it all into one slide, it's a lot of information. Thank you so much. If you have any questions, please let me know.